Welcome. This is Dr. Ross Nash. I've been asked to give a online seminar here. I'm really excited about that. I've entitled it Direct Composite Resin Bonding, but it will also be about a material called a COMPONEER, which is a direct bonding technique. So again, those of you who might have come on just a couple of minutes late, I just started the program, and this is Dr. Ross Nash from Charlotte, North Carolina. I want to talk today about the wonderful world of direct composite resin bonding. I'll take you back to the time when I started doing this type of work back in about 1980. I graduated from dental school in 1978 from the University of North Carolina. But previous to that, I had been an engineer. I graduated from North Carolina State University 4 years before that, 1970, 4 years before I started dental school. And I graduated in textile engineering. That's kind of like an engineering degree, and I went to work for DuPont as a process engineer in a nylon yarn manufacturing plant in Martinsville, Virginia. Well, nylon is a polymer much like bis-GMA resin and urethane dimethacrylate, some of those plastics we use in dentistry. So I got to learn a lot about how polymers worked, and I think that was beneficial when I later decided to become a dentist. I worked for DuPont for a couple of years, and then I went to work for Ciba-Geigy Chemical Company in my hometown of Charlotte, North Carolina. They had an opening there, and I wanted to move back home. And Ciba-Geigy, of course, makes pharmaceuticals and things like that, but they also make dyes and chemicals for textile fibers, and that's the division I was hired in. I was hired as a dye colorist or chemist, and it was my responsibility to develop dye formulations to make certain colors on certain fabrics for the customer. So I got to learn a lot about color, hue, value, chroma, those things we use in aesthetic dentistry. But I was an ambitious young man, and I was introduced to the dental profession through some friends, and my ex-wife was a hygienist, and I thought, wow, this is a great profession. These people are technical, like me, but they also help people in the kind of work they do. They have their own businesses. It was just a really nice, I thought it was a nice profession, so a profession I wanted to be a part of, and I applied to University of North Carolina. I was accepted in dental school, and at age 27, I went back to school. Graduated when I was almost 31 and began practicing dentistry. Well, in just a short period of time, from 1978 to 1980, I had a nice little general practice going. I was placing amalgams and seeing kids and adults and doing some dentures and some preventive, good old bread and butter general dentistry. But about that time in our dental history, something changed something came about to change the face of dentistry. And those of you who were in dentistry back then and are a little bit more mature like myself, I'm almost 65, knows that we did not have light-cured composites when I was in dental school. We had chemically cured composites, catalyst and a base, and there was only a couple of those. Concise and Adaptic are the ones I remembered. And you couldn't do a lot with those. You could place class 3 restorations, and we very carefully etched the enamel margins, never etching the dentin, supposedly. That just was almost blasphemy back then to etch dentin with acid. So we would very carefully etch the enamel margins, and then we could place a class 3 restoration using a matrix strip, and we mix our catalyst and base up and put a little resin, of course, on the etched enamel like Bonacar taught us to do, and of course you'd get tremendous micromechanical retention with set resin and etched enamel. We'd mix the catalyst and base, and we'd inject into that little class 3 preparation and wrap the matrix band around and hold it for about a minute or two until it's set, and then we just kind of smooth it back. There wasn't much polish to these materials were fairly matte finish because the glass particles were so large that they reflected the surrounding tooth structure, but they were not very polishable. That was about it. I mean, you could place a pin in a class 4 fracture in a central incisor and perhaps get a composite to stick on there. Of course, you'd have to opaque out the pin first. Class 5s, posterior composites, really didn't exist because we hadn't reached that point where we had dentin bonding. Then the manufacturers began coming out in the early 80s with light-cured composites, and that changed everything. We were able to now layer these wonderful materials that had different colors, dentin, enamel, incisal shades. We could layer them. We could lay them down and sculpt them. We could actually bond to dentin, we found a little bit later. And we could command cure each layer. And then as we built this final surface, we could turn it into the shape of a tooth. And it was exciting for me. My background in resins and colors helped me understand that this was going to be a really advantageous part of dentistry, and I started focusing my practice on that early in my career. I took courses from anybody I could. Paul Belvedere was one of the pioneers back then, Ron Goldstein, Erwin Smigel, Norman Feigenbaum, Buddy Mopper, some of the pioneers that were teaching back then how to do these things, and usually it was a manufacturer's program because the manufacturers wanted us to know how to use these fantastic new materials. And I'd go out and take these courses and go back and do some of these wonderful procedures in my office, and it just changed the way I practiced. And I decided that this is what I wanted to do. I got appreciation for my patients. You could help someone not only be healthier, but you could also help someone look better. And that was exciting to me. So that's what I began to do. Focused my practice on aesthetic dentistry. And I did a lot of composite bonding back then. We also found out you could etch porcelain and bond it to the natural tooth structure later. And that changed everything again. And we began placing porcelain laminates and even inlays and onlays and full ceramic crowns. So the area of aesthetics has just blossomed over the years. Now I'm going to take you just a couple of years ago when the economy in the U.S. Really took a fall and things began to change. People were more hesitant, and they still are today, to spend the kind of money or make the investment that it takes for indirect restorations, such as porcelain veneers. So we've had to kind of relook at this, and now we're finding that a direct composite restoration is something that a lot of people will afford and will choose to afford today, even though they might like a ceramic restoration later or even never. But the cost of an indirect restoration is a roadblock to a lot of people today. So there are many people, many dentists, who are taking another look at direct composite bonding, and lots of patients are today too. So I wanted to take you through a few cases of direct veneers and show you exactly how I have learned to do it step by step, and then I want to introduce you to a new concept called COMPONEER, which is actually a direct composite system, not an indirect system. If you look at the advantages of a direct composite veneer, one of the advantages is that it's a single appointment. It doesn't take 2 appointments like an indirect restoration often does. There's no lab expense because the clinician is placing the restoration themselves, and therefore they have full control of the aesthetics, and that's inviting to some people. There can be minimal or sometimes no preparation at all. When you're building a composite on a tooth, you can actually wrap around a corner or build into an undercut. You can feather edge margins. It's very difficult to do that type of thing with indirect restorations. You've got to have draw, and you've got to have a certain thickness of the material to get it to the tooth before it breaks. So minimal or no preparation is a real advantage, and it's conservative dentistry. Also, composite can be easily removed from the tooth. I find that a bonded ceramic is sometimes very difficult to remove from the tooth structure because it has to be cut off, and you most likely will take more tooth structure each time you do it. But a composite resin can be removed with a carbide finishing burr, and you get right down to the tooth. It's the closest thing I've found to reversible, because you don't damage the natural tooth any more than it already had been. The cost is a big benefit to the patient today, and that's really the deciding factor, as we already discussed. And you can do these at a lower cost because there is less expense. There's not a laboratory. There's only one appointment, and we can actually do these at a lower cost. I generally will charge about half of my porcelain veneer fee for a direct veneer. And not only are they easily removable, composite is easily repairable. In my hands, ceramic repairs are long-term provisionals because you normally repair them with a composite, where a composite restoration can be repaired, and you probably will never see that repair for the life of the restoration. So it's very easily repairable. In addition, there's some beneficial properties to composite, and the properties include something called resilience. Ceramic materials are not resilient. Resilience means that the material will bend before it breaks, and composites are. Because of the resin matrix, they'll actually absorb some stress, and they'll bend and slightly move, where if a ceramic bends, it breaks. So composites have resilience, and that's beneficial. They also are non-abrasive to the opposing tooth. Some ceramics can still braid the opposing tooth, and composites will not do that. And of course, one of the benefits is that you can layer these materials now and develop shades. It's not just a one color monochromatic restoration. Well, let's look at some direct veneers. This pretty lady on your right there was a college student about 7 years ago. Here's my cursor. You guys see the cursor here. Beautiful woman, and she was in her early years of college. Lived in California, lived in North Carolina. She was home for a short period of time, and while she was there, she wanted to do some changing of the aesthetics of her teeth. As you can see, her smile is beautiful. She's been through orthodontics. She's got beautiful periodontal health, as you can see on the right here, and virtually no dental disease at all. Now, you'll see when I show you the occlusal view, she does have a lingual wire retainer on the lower where the orthodontist had placed that. But the maxillary teeth had these spaces. The reason the spaces were there was because they were naturally formed teeth. You can see they're small teeth. I call these screwdriver incisors. They get narrower towards the incisal edge. You can see how they're actually curled over there. And I think they're beautiful the way they are, but she did not, and she wanted her teeth to be larger and look like she wanted to look like an adult, she said. We talked about indirect veneers. Of course, we could do a no preparation porcelain veneer here with no problem. However, due to the cost and the time restraint, she was only going to be in town for a week, she asked if I would do direct veneers, and of course, I love providing direct veneers for patients. These are the colors. This particular case was done by a material that was developed by Ivoclar. Four Seasons was the name of it. They now have Empress Direct, wonderful composite. And these are the shades we picked. We picked a dentin shade, an enamel shade, and an incisal shade, and you'll see how we use these. Well, let's run through step by step, and you'll see that I placed one at a time, and that was the technique that Buddy Mopper taught me many, many years ago. Buddy Mopper and Norman Feigenbaum. And this is the way I normally place a direct veneer. I'm going to protect the adjacent teeth from the etching solution with the, as you can see, the matrix strips there. I'm going to acid etch. All it takes is 10 seconds with 37% phosphoric acid. And then we're going to rinse thoroughly as about another 30 seconds. Another 10 seconds to make sure that we have a very clean surface. And you can see that beautiful etched enamel surface that we all are aware of. And then I'm going to re-wet the tooth, either with something like Gluma, a desensitizer, but mostly it's the water. I want a slightly moist surface for the hydrophilic bonding agents that come after this. So we're just re-wetting the tooth. You can see on the right-hand screen, that's my suction tip. It's suctioning the excess water. So it's slightly moist. And then I'm going to come back with, this is a 4th generation bonding agent. It happened to be the one by Ivoclar, Excite, a very nice bonding agent. And we are going to saturate the tooth, blow it thin, get rid of the water and the carriers, the alcohol carriers, and then we're going to light cure the composite. So, the bonding agent. The bonding agent has been cured. Now I'm going to start by filling these spaces with what we call the proximal shelf in a dentin shade. And then the dentin shade, as you can see here on my instrument, is more opaque than the enamel shade, so it's going to block out color better when you have transitional areas like this and where you can see through. So I'm going to build that proximal shelf out of the dentin material freehand right up against the adjacent unetched tooth that is adjacent to it. I will light cure that particular increment for about 20 seconds and then I'll move on. Now over that dentin shade we're going to place a little enamel layer, and the enamel here has more translucency just like enamel does, and so we're going to place a layer of enamel and then we'll light cure that. We're going to do the same thing on the distal aspect of this central incisor. So what's happened is we've basically built the proximal areas, and in this case they match very well. We really don't need a facial veneer, but this patient has some deficiencies in the facial aspect there, so we also, after we cure our direct composite that we placed, we're going to come back with a full facial veneer, and as you can see, this one is the clear color. And that's how we're building the facial aspect here. And we've used dentin, enamel, and now a clear incisal shade. We're going to just sculpt that as much as we can before we light cure, and then we're going to light cure again for 10 to 20 seconds. Now the entire build-up on your left-hand screen there, the left-hand picture, has been finished, and I try to put most of my anatomy in as I go, but there's still some to be completed here. On the right-hand screen you can see I'm finishing my gingival margin to make it paper thin, feather edge, so it disappears, and protecting the tissue with a metal instrument. The lingual aspect of the on the left side, you can see I'm using a carbide burr to do some finishing. And now we get our basic shape on the right-hand screen. I'm using an American 8A, which is a stiff metal spatula, to go into the interproximal and give it a little bit of a torque, because this periodontal ligament above the central incisor will give just a little bit, and those teeth will slightly separate. Now, if you have protected the adjacent tooth from the etching solution, or if you have a composite that is highly polished, you can use this direct technique without using matrix strips. And I find I get real good contacts that way. So now that I have separated these slightly, I slip a metal strip in there. This is the gateway strip by Brasseler, and just to break that contact in there, and it still has, as you can see on the right hand screen, it still has a very nice contact. The number 12 surgical blade, you can see, is used just to cut off a little overhang or cut in a line angle. And then we're going to polish with various different polishing instruments that are out there. These are cups by Ivoclar. Don't forget the interproximal polish. Epitech strips here by GC were used to polish these aluminum oxide strips, and I'll use all 4 grits. I want to get this interproximal surface just as smooth as possible, and so that first of all it won't stain, but also so I can build up against it without bonding on the next tooth. And then these little compo brushes, if you haven't tried these, you've got to try them. The restoration can be very smooth with the other polishing instruments, but that little compo brush used at high speed, and it's in a slow speed handpiece, but as fast as you can go with a little bit of pressure, not a lot, and you use it dry, and that surface will just really come up to a high gloss. So you can see that the right central has been finished. And you can see the incisal edge view of the right central on the right-hand picture here. And now we're going to move on to the other central. And we'll go through the same exact steps. Acid etch, rinse, re-wet the surface, add the bonding agent, dry the bonding agent, leave that gloss, and then light cure the bonding agent for 10 seconds. Now we're going to add the proximal shelf and the dentin shade, which will keep light from going through in the proximal. Build the proximals exactly like we did on the other tooth. And then light cure. I'm on the right-hand screen now over the dentin layer that I used for that proximal shelf. I'm layering the enamel. You see on the left-hand screen here now the enamel. And then we're going to add some incisal length with this. And I'm using the enamel shade for that. This is a micro hybrid or a nano hybrid. They're very strong and they can function. And then cure that. And now you can see I'm adding that facial veneer with the clear material. Same technique, and it's finished completely. And then I place the laterals and the canines. In this particular case, we simply use 6 direct veneers to give this beautiful young lady the look that she wanted. And you can see the incisal view. And here's a full occlusal incisal view, and then the facial view on the right-hand screen of the finished product. And you can see the full arch on the left and the smile on the right-hand screen. That's before and after from a proximal view, and you can see the spaces have been filled, the contours have been improved, and the color is virtually the same as the rest of her teeth. Now don't look at the picture on the right here, that's another case, but you can see the picture on the left is the final result on that direct veneer case. Now this was many years ago, I'm going to say probably about 9 years ago. I saw this young lady recently and they were still looking very good. On the right hand screen, let's start another case. This is a pedodontist in Charlotte, North Carolina, who had some composite bonding placed on her teeth many years ago when she had a fractured incisor. So she asked me if I would restore those for her with the new materials. Now this particular material is called Aesthetics by Caulk, another good material, a beautiful nano hybrid that has various shades and colors. You can see here that even their shade guide shows you what different materials to use to get the A1 shade. And A2O, A1, and that's the enamel shade, and the CE, which is the translucent shade. So the first thing we're going to do is to hang on just a minute. The first thing we're going to do is remove the old composite, and that's what I'm doing with the diamond burr here, beveling that edge and doing a little removal on the other side. We're also I found the best way to hide a class 4 is to place a facial veneer right across it. And I mean, sometimes I can take a class 4 and make it disappear, but most of the time you can see a little bit. So all I have to do is put a thin veneer across the facial and you'll see it completely disappears. And of course she wanted a veneer on the other tooth also. So that's what I'm doing. Just a very minute amount of preparation just to make a little space for some composite there, probably 0.3 of a millimeter or less, completely in enamel. The occlusal view of the prepared teeth are on the right. And now we're going to build these just like we did before. Acid etch, rinse, place a bonding agent. I'm sorry, let me just go back to that one. This is actually a re-wetting agent again, and that was a material called Calmit by Caulk. And it has some antimicrobial, but it's mostly water, and that's my purpose, is to re-wet that surface And then on the right-hand screen, I'm adding the bonding agent. That's Prime and Bond NT. Total Etch Technique by Caulk again. Dry it, get rid of the alcohol or acetone carrier in the bonding agent and the water that you left on there, and then light cure the bonding agent as we are on the left-hand screen. Now on the right-hand screen, I'm adding my Denton shade that we have chosen, and we're going to build up those areas that correspond to Denton. Sometimes we'll build it up incrementally, and you can layer these materials and then cure them. They're just as strong as if you put it on there in one piece. So you can see on the right-hand screen, I'm adding a little incisal, light curing on the left-hand screen. Now I'm adding the enamel shade on the right. So that entire surface is the enamel shade, and then I'll light cure that. And then take a little incisal, the translucent shade. You saw that was the CE in this case, and add that to that surface too, which will end up being mostly just on the incisal area. I'll cut most of that back. So 3 layers, Denton, enamel, and incisal. The finished cured buildup is on your left-hand screen, and now it's my job to turn this into the shape of a tooth, and that's where a lot of the artwork comes. Of course, the layering is important, but also the shape is important. So I'm using a carbide finishing burr on the lingual. I'm using a little small carbide burr to finish the gingival margins, protecting the tissue from the carbide burr with that little spatula. That's the number 12 surgical blade. Remember that? Well, I use it on every case. I'll cut off a little overhang or cut in a line angle. This is an enhanced disc by Caulk, a very nice instrument that will give you a smooth surface, and you can contour with it a bit also. You notice here on the left-hand screen, I'm using the Buddy Mopper's Mopper Torque, separate enough, it'll pop free here, and you get a metal strip in there just one time, and then finish the restoration, polish it. And this is again an enhanced cup, give you a real smooth finish, and then you follow with their polisher on the right-hand screen. Don't forget the proximals. It's very important to get the proximals highly polished. And again, these are Epitex strips, aluminum oxide strips. These happen to be by GC. So the first one is finished on your left-hand screen, and now we have progressed on the right-hand screen and completely built the left central in the same fashion, right up against this polished composite surface. And there you can see on the left it has been finished, and the before is on the right. And again, here again is the final result with the 2 centrals finished with direct composite bonding, and the incisal view of the before is on the right, and the incisal view of the after is on the left here. And before and afters can be seen one on top of the other in the next one. That's the dentist's smile, and she was very, very happy with her new restorations. Now, we can also place composite for not only direct veneers and class 4s, but we can use class 3s and class 5s, all kinds of areas. And this gentleman was a more mature gentleman, and he wanted his 4 anterior teeth restored as they were many years ago with composite. I suggested porcelain veneers, and he was only interested in composite bonding, mostly because of the cost difference. So that's what we're going to do for him. And you can see his preparations are on the left, class 3s, class 4s. If you can look on the right-hand screen, one of his centrals could easily justify a full crown. There's half of that tooth missing. But we're going to build these up with composite. In the left-hand screen, you can see we completely finished building up the right central with various shades of dentin enamel and incisal shades, and you can see the occlusal view or the incisal view on the right-hand screen. And the left picture here is the first one's been completely finished, and you can see the incisal view, the same thing on the other screen. And then we're beginning, we built up the second one in the same fashion, building right up against this polished enamel surface. And now it's been finished on the right, and then we'll complete the laterals at this point. So 4 direct composite restorations. You can see the finished incisal view on your left. In this right-hand screen is before. These are the preparations, and here are the after incisal views. So again, if you look at the before here and the after here, this gentleman was very happy with that. And to show you one more direct case, and all these are going very quickly because it's the same process, but just to show you that direct bonding has a lot to do with not only placing the material, and most dentists can very easily place material. They know how to bond to the teeth. They know how to add the material to the tooth. Clinically, most of us can do it very, very well. The biggest part of this, though, is not applying the material. It's the artwork that is involved. And this young lady had some direct veneers on her upper 8 teeth, her maxillary 8 teeth, premolar to premolar, for a number of years, several years, and then she moved to Charlotte, and some other dentist had done a nice job. But she had chipped the incisal corner off of one of them and heard that I did some bonding, so she came to me and asked me if I would repair it. You can see the incisal view of how she entered. Close-up view of the left central, which had the chip. Now, the thing that we found as she was looking through my before and after pictures, she said she noticed a difference. She said, "Dr. Nash, yours look different than mine." And I said, "Well, what do you mean?" She says, "Well, they're shaped more like teeth." Now, that again is a matter of art, and I've studied the art of it, and so a lot of dentists can do a good job of making restoration, the composite, look like a tooth with line angles. And it's more than just a rectangle here. You know, there's emergence profile, there's a mesial line angle, there's a distal line angle. The distal is slightly rounded, the mesial is slightly pointed, there's some developmental grooves. There's even pericomata and texture. So there's a lot of things going on in a centralized incisor besides just a new front on the tooth there. And she saw the difference and asked me if I would replace them all. Again, I said that the previous dentist, was a female dentist, did a nice job for her, but she wanted them to look the way mine did. So you can see a carbide finishing burr was used just to remove the old material. Came off very easily, and I don't think the previous dentist prepared the teeth much at all. So it's very, very conservative. We did open up the proximal contacts, though, because her midline was off. The angles were not quite right, and so we were going to build some proximal surfaces. So that's the most aggressive part of my preparation, was just to open up the proximals for an aesthetic reason. And then we built these in the same fashion. Now this one, particular one, was built by viscose material, a wonderful composite. So acid etch, rinse. There's bonding agent, that's all bond 3. Excuse me, let me go back here. That's a re-wetting agent. Again, that's Caulk's Calmant, which is mostly water. And you can use water, just slightly wet the surface. And this is all bond 3, which is actually a 6th generation bonding agent, if I remember. No, I'm sorry, it's 5th. And I'm placing the bonding agent just like before. We dry the bonding agent, we light cure it, we add our proximal shelves, the proximal areas to develop the dentin. Then we come over the top of that with an enamel shade. I'm trying to place some mamelons in the incisal portion so I can layer some trans in there. So there's the dentin and enamel built, and you can see how white she wants. These are real white teeth. She wants very, very white teeth. That's why she got the veneers in the first place, direct veneers, because she has some modeled tooth structure there. And now you can see I'm putting the incisal layer on the edge to develop a little bit of trans. And then we light cure. So the entire tooth has been built up, and we go through the same process. Contouring, various different instruments, finishing, polishing. This is Bisco's polishing system. Number 12 surgical blade to remove a little overhang or cut in a line angle. Polishing the proximal surfaces. And the first one's finished. And then we finish the second one. And then go right through the same process, and then the laterals and the canines and the premolars. So those are the finished composites on the left-hand screen, and the incisal view of mine. If you look before and after, this on the left-hand screen is what she came in with. On the right-hand screen is the difference. And it all comes down to style, artistic style, because the veneers on the left-hand screen, in my opinion, were every bit as good a quality as the one on the right. It just comes down to the artistic style, befores and afters. So there's the final result, and before and after with her full face on the right. All right, so direct bonding. One of the things about direct bonding is it takes a long time. It takes me approximately an hour, a little under an hour, per direct veneer. And so it's time intense, and the doctor cannot get up and go do other things. Neither can the assistant. It's the doctor and the assistant, full time, each hour, total focus. So you know, it's not easy. I mean, sometimes you go home and your back is hurting from it, but it's a wonderful to offer it to the patients today. Now, what if the dentist who says, "Gosh, Ross, I love to do direct bonding, but it's so labor intense, and that art on the surface is hard for me to achieve, the shape and the translucency." What if we had a final layer of composite that we could place on the facial aspect of a direct veneer? Well, that's what a COMPONEER is. When I saw this system, I was extremely impressed. I was very fortunate that Dr. Besic over in Stockholm, who developed this technique and the materials, came to the United States last year, and I was invited to listen to him with about 5 other dentists by Colteen at their national sales meeting. I was very honored to be one of the 6 dentists in the country to be introduced to this. I was very impressed with this, and I want to go through it. What a COMPONEER is a polymerized, prefabricated, enamel-shaded composite laminate. Now, it's not an indirect laminate. It's a direct composite veneering system. It can simplify the freehand technique for a lot of dentists, and I'll show you why. It can increase the quality of the front teeth restorations, and that is because this material, even though it's the same composite that's underneath, and it's Synergy Composite by Colteen, it is a little more dense because it's made under pressure, and it has a little more stain resistance and less porosity. So it can actually increase the quality of the facial aspect of the restoration. And it's definitely an economical approach today because I have found that I can place a COMPONEER about twice as fast as I can a freehand veneer. And that helps increase or provide a cost system that the patients can afford today. All kinds of things you can do. You can see on the left-hand screen, these are Dr. Besic's pictures, class 3s, class 4s, dark teeth, peg laterals, class 5s, again, fractures, diastemas, mottled enamel, all kinds of different reasons that we can use a composite veneering type system or even a composite buildup system. If you look in the right-hand screen, these are different composites that are on the market, but I want you to notice, and one of the things I like about Synergy by Colteen is that it is so dense and has a lot of polishability and durability. It's a very, very nice composite. As far as shades go, in the United States, or actually these are Dr. Besic's slides again, he's recommending that we use the A1, B1 Dentin shade underneath and then the light enamel on top for young people. On the other hand, we're saying for the more aged person, a mature person, they might use the universal shade of veneer. Frankly, most patients in this country want this one. I don't care how old they are. They want white, white, white. That's just the way it is. So what are our challenges in composite handling? Well, some materials are sticky, some aren't. It comes down to surface wetting. How good is it wet the surface? Smoothness. How smooth can you get it? How homogeneous is the material? adaptation to the tooth structure and to other composite materials, texture, shape, and internal bubbles and wetting defects. So if there are a lot of challenges that I have found that these COMPONEER materials can really help us with. You can see on the left-hand screen, this again is one of Dr. Bessick's direct bonding cases that he did years ago, and there is some pitting on the surface, and I know you've all seen that. I have had pitting in the surfaces of my own freehand restorations. That is much of that is eliminated with this COMPONEER system. That's the system on the right, and it has everything you need in it, including the veneers and all the instruments, and we're going to go through that. Again, I call this veneer, but it's not really a veneer. It's a freehand technique. It's not supposed to be an indirect restoration. It's not. It's a direct restoration. They have all the different colors and shading. It comes in these packages, and they'll tell you on the back of the package which one you have out of that package, and you can put that in the patient's chart for record keeping. And you can see how the translucency and the colors and the shape is all built in. And that's advantageous when it comes to the aesthetics. Let me just go through a couple of Dr. Bessick's cases real quick here. This is one of his cases where he found the possibility of using the COMPONEERs. So the shade guides, by the way, they nestle within each other. It's really nice. This is the dentin shade. It goes inside this enamel shade. You'll see that later. And it really does give you the effect of the two together. And you can see the guides that come with it are the exact shape of the COMPONEERs, so you can pick out the shape that you want. Just two shapes there. Now, Dr. Bessick uses a rubber dam. I don't. I use lip and cheek retractors, and you'll see that in just a little bit, but this is his case, placing the dam. He used a little cord here. I rarely use cord myself. And then he's basically going to do his contouring. I call this getting rid of the bad stuff, keeping the good stuff. Just getting down to healthy tooth structure, get rid of decay, etc. Just like you would in any composite technique. And then he's picking his sizes, and again, if you look, they have a high opalescence, natural blue effect of enamel is built into these, high flexural strength. The modulus is similar to natural tooth structure. And over here, this little instrument was developed again by the company, and it beautifully holds these materials while the assistant's working on them. You can reshape these. You don't have to accept the shape that they're in. You can actually change the shape of them with a disc. Dr. Bessick is using aluminum, just a what do you call it, a micro etcher right here to just resurface the tooth or get the surface ready, and then he's going to use the etching gel. So everything. Now he did all these at once. I'm going to show you two different ways to do it, singly and apart. And all together, but here's the edge surface, and here is the bonding agent. That bonding agent by Colting is called One Coat Bond. It's a very nice bonding agent. And then he's placing strips in the interproximals. You see, every one of those has a strip in between. I found out the reason that he can hold these in place is before he light cures the bonding agent, he places the strips in there. Then he light cures the bonding agent, and they stay in. So that's what I've started doing. And he's applying some of the material here. This is Synergy Composite to the surface of the tooth and to the internal surface. He's putting a little resin first on the internal surface, and then the internal surface of the COMPONEER. That's a wonderful instrument also, that a new placer that he's developed, and you'll find that works quite nice. You can press on these materials. I've never broken one doing this. And then you can take the little spatula or instruments they have in the kit and clean up the excess around there. Now, he recommends placing both centrals at once before you light cure either one of them, so you make sure that you get the horizontal vertical plane correctly. And then light cure. And then place the laterals. Now, if you have a little area that you're worried about, marginal area, you can use the Synergy Flow, flowable composite. Just flow it in there right now as you're building. And at this point, they're all bonded on there, and it's just a matter of freehand bonding at this time. Although now you have that facial surface anatomy that is very difficult to develop freehand. So this is what I'm doing. I'm just, Dr. Bessick was doing is just finishing it just like he would a freehand veneer with all the techniques that we talked about with my freehand technique that I showed you before on all 4 of those cases. Same technique. The advantage here is that he was able to develop this facial anatomy, place the enamel layer all in one piece, and true enough, it's twice as fast. This is a little compo brush I told you about, and it brings this surface up to a very high gloss. You can also change the surface. You don't have to accept the anatomy that the COMPONEER has. You can actually go in and change it and repolish it. And this, one of the polishers, or actually this is a point in the system here, can be used to change the surface, and you can use fine diamonds for that too. So you can see on the right, beautiful case, and Dr. Bessick is a real master. It is my desire to study with him too. If you just made these freehand veneers yourself, and say, well, why can't I just make them myself on the tabletop? Well, you could, but the COMPONEERs are actually made under pressure, and they are very dense, very non-porous, and that's an advantage to this facial surface. Here's some more cases of Dr. Bessick's. Here's an example of a bulimic patient. Had to open the bite a little bit, so he built the posteriors in direct composite, opened the bite, and used COMPONEERs for the anteriors. Class 4s on the right-hand screen. How many times do we see, oh, excuse me, I went too fast there. How many times do we see these old composites come in and they're discolored? And he used a COMPONEER technique to do this case too. Again, you don't have to accept the shapes on the left that come. You could actually take some sandpaper discs and recontour those. You can also place a single veneer. This is one of Dr. Bessick's cases where he decided that he needed a single veneer on the right hand, and here is his technique. I'm going to go through it very quickly because I'm going to show you a video in just a minute of one of mine. So you can see he's reshaping on the left, he's bonding the COMPONEER. On the right, these are all the steps we're going to go through in just a minute. And the pencil marks on the right-hand screen is so that he can reshape, showing himself where he wants to go, and then polish. So, a single COMPONEER is another advantage. You can place this in about a half an hour. Now, this is one of the cases I did early, and I videotaped this. A beautiful woman who would like to have a nice smile for her wedding. I recommended porcelain veneers here. She just couldn't afford it, and we talked about the option of COMPONEERs, which she jumped at. I could do it for half the price. So I'm going to take you through this video. The video is about 12 minutes, and we'll watch it step by step. Here's my patient, and we're coming in close on her smile here. And it'll be retracted in a minute. That's a retracted view. And of course there's some other things that need to be done. She's got a broken tooth on the lower left. She's got some other things too. But her primary concern is the way her maxillary anterior teeth look for her wedding pictures. So the first thing I'm going to do is get rid of the bad stuff and keep the good stuff. That's my objective. In other words, I want to get down to sound tooth structure. I'm going to remove any old composite and tooth structure that is decayed or deteriorated. I want to get down to sound tooth structure. That lateral incisor that we're working on right now there's not going to be a whole lot of tooth left. That was mostly composite, so this is pushing the limits that could easily have been a crown on that tooth, and I'm almost worried at this point I'm not going to have enough tooth to crown even. But you'll see when we got through it worked out really, really well. So, we're just talking about the 6 anterior teeth, so I'm removing the bad stuff and keeping the good stuff. In other words, I'm getting down to sound tooth structure and making just a little bit of room. And you can see now I fast-forwarded here, and I am finishing my preparations, opening this the proximal here just a little bit so I can refine that midline. And one of the ways that you can do this technique is to pre-fill all of those areas, like the Class 4 and Class 3 areas, and then just place the COMPONEER on the facial surface. That's one way. You can also backfill after you put the COMPONEERs on and place some composite from the lingual, and I'll show you some examples of that. But at any rate, here I'm just restoring a Class 3 acid etched. Here's the bonding agent. That happens to be Colteen's one-coat bond, an excellent bonding agent. And we're going to make sure that has a good thorough cover, and then I'll blow that thin to remove the alcohol carrier and the water that might have been left on the tooth. So here we're going to blow it thin. And we'll light cure the bonding agent. A small Class 3 area like this is, I have no problem using a flowable composite alone rather than going back with one of the restorative materials. This is all I needed to fill that Class 3 area. So that's the synergy flow. And we're going to light cure that. And go ahead and finish it. I'm going to finish it right down to my final surface, and we're going to place the COMPONEERs on the facial aspect. Now the Class 4 area we're restoring the same way, acid etch for 10 seconds, and then we're going to rinse that thoroughly. Leave it slightly moist. And then we're going to add our bonding agent. Again, a good thorough coat. You can't use too much bonding agent. You can certainly use too little. So I make sure I saturate the tooth with the bonding agent. Then I'm going to blow it thin, leaving that glossy surface of the bonding agent, and then light cure the bonding agent for 10 seconds. I usually use, in fact almost always, I'll say always at this point, a flowable base before I add a restorative composite. I find that this causes my margins to be superb, decreases sensitivity, and gives me a very good adhesion to the tooth. So I like to use a flowable base. That was Synergy Flow I used as a base. And now I'm going to come back with the restorative composite. Now notice that said enamel. My assistant accidentally, and I was doing the video here, so I was focusing on the teeth, and she handed me the enamel rather than the dent and shade. That should be a dent and shade at this point. So you'll see the difference. We went ahead and used it, and it worked out just fine. But that really should be the dent and shade rather than an enamel shade that we placed there. So I'm going to finish the contour. Just as if it were a veneer preparation. You can see the darker area there where that enamel composite was there. So now I'm going to try in my COMPONEERs. I've chosen the sizes, and we're trying them on the teeth, and they're going to be beautiful. So we're just making sure that we have the right size and fit. And at this point, I place these one at a time, just like I normally do, freehand bonding. So I'm acid etching the right central. Again, it's just a 10-second etch. And then we're going to rinse that thoroughly for another 10 seconds. We're replacing our bonding agent. And again, we'll blow that thin before we light cure it. Blow that thin. and light cure. Here I'm placing a lighter composite on the internal surface. This is Synergy composite, of course. Synergy composite is the same material that the COMPONEER is made from. But we wanted to bump up the value just a bit, so I used a little lighter composite underneath. And we're putting it into place with our little placement instrument and then removing the excess around the margins. And at this point I got lucky. I didn't put both on at the same time like Dr. Bexlick recommended. I did get my line angles straight there. And now it's just like freehand bonding. We're finishing the margins, we're contouring, we're polishing. It's exactly the same as freehand bonding at this case. At this point. But I've had my entire enamel surface in one piece rather than layering it as you saw me do in the freehand technique. By the way, my sponsor has added 10 minutes here because I'm running a little bit long, so don't go away, you guys. We have 13 minutes left, and I think I'm going to make it. Now, one of the things I like about the individual placement technique is that we can now polish the proximals to a high gloss. When you place all of them together, I have a little bit more trouble with the interproximal polishing. So I've been able to completely polish my proximals there. And now I go on to add the right central, just as you guys have done before. So you see I'm acid etching the right central. I did use a plastic matrix here to protect the adjacent tooth from the etching solution. Is my cursor showing? Now we're down to the bonding agent. As before, light cure the bonding agent and add my enamel surface, which is the COMPONEER, just as before. That is a handy instrument. You're going to love this instrument because it actually, you just push against it, little circular motions. Notice I'm making sure I hold that COMPONEER directly against the other tooth so I have a good nice contact, even though I have a plastic matrix strip there. And now again, it's just like freehand bonding. We're going to finish the margins, shape, polish, just as before, using all the various instruments that we did in freehand bonding. Now I'm going to go ahead and go out of the video and on to the final here, because this again was before, and you can see the incisal view before. We're choosing a shade, picking the size of the COMPONEER, doing our preparations. You can see the preparations on the right-hand screen. Do our build-ups. Here you can see the build-up that I did in the lateral. And our preparations, placing the COMPONEERs, and here they are all in place. 6 COMPONEERs. That entire procedure took me less than 3 hours, and that was with the videotape. So a lot faster than my freehand bonding technique. Before and after on your left, and again there was the before on your right, and now There's the after on the left. Tissue's not totally healed in this case. This was just about 3 days afterwards. One of my favorite parts of this work, any kind of aesthetic work, as a matter of fact, is the fact that people really appreciate you, and it's very rarely do I get a kiss like this for root canal treatment. That's for sure. All right, let's go through just 2 more quick cases. This one on the right is a lady that would like to have a pretty smile. You can see she's got a lot of problems. There's some partial she's got some missing teeth. Periodontally she's in good shape, but she's got some old bonding on her anterior maxillary 4 teeth, and she's just very unhappy with the appearance and has limited funds. So for half the price of porcelain veneers, I placed some COMPONEERs. Here's the incisal view. You can see her partial in place on the left, and removed the partial. And these are her old bonded, direct bonded veneers she had. You can see the shade guide here. This one nestles inside this one. It really looks nice, and you can put them together and you can see what the shade's going to look like. That's a handy part of the treatment. Here I'm picking out the size, and on the right hand side I'm getting down to the good stuff. Remove the bad stuff, get down to the good stuff. So again, it's all preparing the teeth just as we did before, removing the old class 3 restoration, some decay she had there, and getting down to sound tooth structure, just as you would do in freehand composite bonding. You can see the prepared teeth are on your left in the incisal view, and now I'm acid etching. I'm rinsing. There's the etched tooth surface. Trying on my COMPONEER. Placing the bonding agent. Here I'm going to place these all at once, like Dr. Bessick's recommendations are. Dry the bonding agent, but before I light cure it, I'm going to put my little strips in there. So I cut little matrix strips in, placed them in between each tooth in the proximal areas, then light cure the bonding agent, and I find that those little strips stay in real well. In fact, I'm taking some scissors there and shortening the facial aspect like you see here, so I'll have room to get the COMPONEERs in place. And there's my first COMPONEER on the right. We're treating it with you put a little bit of the bonding agent on the inside, blow it thin, don't cure it, adding my A2 B2 shade on the internal surface, bringing it to the tooth, using my placement instrument, remove the excess. Number 12 surgical blade is handy for that also. Making sure it's all the way to place. Before I cure it, I'm going to place the other central. Same fashion. And I'm using a little spot etching light right here. This is by, oh golly, I'll think of it in just a minute. Yeah, I can't remember the name of the company. Anyways, a little spot etch right there. Parkel, excuse me, it's Parkel. Has a light with a spot curing tip on it. And I'm using some flowable, this is Synergy Flow, because I noticed a little defect in my margin. You can fix it right there. Light cure it. And same thing, place the laterals. Notice I'm going to go back here, place a little bit of the Synergy composite on the tooth structure and a little bit inside the veneer, and place them both together. That way you'll get less voids. Same technique, place the other lateral. Right on down the line. Using a little Synergy on the lingual aspect of one area there, the composite, just to fill in a class 3 area. So I backfilled the class 3s in that case. Completely cured, removed my strips, and now again it's just like direct bonding. Using a number 12 surgical blade to shape, remove excess, carbide finishing burrs to contour, a little fine diamond, we call this a mosquito diamond, finishing that gingival margin, a sandpaper disc, interproximal strips, just like in freehand bonding. Now I'm reshaping a little bit with the points in the COMPONEER kit, and then polishing. And you can see the high gloss we got. So that's afterwards. 4 COMPONEERs. This particular case took me less than 2 hours to accomplish. Incisal view, with and without the partial in place. That's before, the preps, and after on your left. And you can see them all 3 together on your right-hand screen. Very happy lady. Before and after on your left with 4 COMPONEERs. Now this is my last case. I've got 4 minutes and 23 seconds, so I'm going to get through this one, and it's just perfect. This is Mrs. Florida a number of years ago. Beautiful woman, and she brought me that picture when she was Mrs. Florida, and she was also Miss Florida before that. But if you notice on the right-hand screen, she has a chipped mandibular central incisor. More than chipped, it's fractured. And the other one is slightly rotated. So we're going to use COMPONEERs. Shade A1. You can see we nestled our shade guides here. Now, so I picked my shade, and the first thing we're going to do is recontour the lower teeth, just as if you were going to do freehand bonding, or some people would do porcelain veneers here. So I've done my preparations. I'm trying in my COMPONEERs. Beautiful little COMPONEERs here that are going to be just perfect. Checking my shades again. Alright, at this point we place my matrix strips. I'm acid etching. I'm placing my bonding agent. Light cured the bonding agent. I discovered I was having a little bleeding here, so I did go back and place some cord. It's very important to control hemorrhage, obviously. Reapplying the bonding agent. And my strips again. Light cure to hold my strips in place, and then place some Synergy composite on the tooth itself. And a little bonding agent inside the COMPONEER along with the Synergy composite.
That's a Q&A too.
Same technique on the lower as we used on the upper. And now they're in place. You can notice I used a little flowable in one area to seal that margin. And then again, it's just like freehand bonding. Finishing, shaping, polishing, and the final result is on your right. You see the COMPONEERs on both of the centrals, and there's the new smile. Before and after. Left is before, right on both pictures are after. Before and after, and again, the new smile. Alright. I just got through it. We have 1 minute and 13 seconds for questions. Let me see if I can answer one here. I'm going to go down to the bottom. And it says, go to Q&A. Alright. Would you be able to leave a dent and shade in the lingual face? What's that?
Click on it, it'll go over here.
Okay, my brother's helping me here. Can you leave a dent and shade in the lingual face without placing the enamel shade? Certainly you could. You can build a freehand composite with Synergy composite, freehand veneer, all kinds of things. And if you don't need the enamel shade, then you just eliminate the COMPONEER. But the whole idea is that you would have that enamel shade. Let me choose this one here. Would you be able to send me the names of the products you use at the end of the presentation? I'll do my best to do that. Jimmy, here's back home write down that email. I'll try to do that for you. Good night. How long does it take to repair and 6 upper veneers from 6 to 11? All right. Again, about a half an hour a tooth. It used to take me almost an hour, so I can reduce my time by about 50%. And my time is gone, but I'll answer this one last question. You started building on tooth number 8 and filled the space between 8 and 9 completely with just building on tooth number 8. Oh, that first case, that was because I was moving the midline over to the left, and that was a good, was a very good for you to notice that I didn't build on both teeth on that first one. All right. Thank you.